Hello everyone, my name is Lady Bettina Sanga. I'm a student from nutrition, introductory nutrition with the Professor Jeffrey Brown and in fall 2022. So my subject is about the dumping syndrome. I will talk about dumping syndrome today, September 19, 2022. We'll start first by the table of content. In the table of content, we have the definition, causes of the dumping syndrome, symptoms, risk factors, medical and nutritious management, long-term effect, and at the end, we will have the references. So, in the definition of dumping syndrome, we can say it is a condition in which food, especially food high in sugar, move from your stomach into your small bowel too quickly after you eat. So what is going on is like you have an impaired gastric movement volume, right? The capacity or gastroenterostomy, you have a rapid delivery of nutrient into the duodenum. The agent that increase meal viscosity, guar gum, pectin, and glucomannan, that is just those are nutrient names. The diet that will go directly to your duodenum instead of going by the stomach, going the normal process. So in the next we are going to have a rapid absorption of the glucose, a hyperinsulinemia response, which is when you have a insulin which is high, and we have a somatostatin analog, which is a short acting analog or long acting analog. You have a hyperosmolar content in the duodenum due to the high volume of food, of nutrient which come to the duodenum in like in one time. Okay, you have a release of vasoactive agent, a release of incretin, a release of glucose modulator. All those are hormonal that are which are located into the duodenum. And now you have a which result all that like after you have eaten your food, what I might say is after you have eaten your food, instead of the food to go through the esophagus, the stomach, the big and the small intestine, no, the food goes directly to the in the duodenum, which is not good because it might cause several problems like we stated previously. It will it will prompt all the all the nutrient, all the hormonal to come directly, all the hormonal located in the duodenum come directly to start doing a job that they are not supposed to do. So that's what is happening, and that's what caused the early dumping syndrome, which is vasomotor symptom who can act as a vasomotor symptom, gastrointestinal symptom, and hyperglycemia because your glycemia will show up in your blood like you have a hyperglycemia, which is not good. So the cause of dumping syndrome, we can say it is caused by food and gastric juice from the stomach moving the small intestine in an uncontrolled, abnormal, fast manner. This is most often related to change in the stomach associated with surgery, including any stomach surgery or major esophageal surgery, such as the removal of the esophagus, which is oesophagectomy, oesophagectomy. But in rare cases, dumping syndrome can develop without a history of surgery or other apparent causes. So we have to be mindful of the amount of sugar we are consuming. So as a symptom of dumping syndrome, we can include feeling bloated or too full after eating nausea. After eating, we can have nausea, vomiting, abdominal cramp, like your stomach will start doing like this. Uh, diarrhea, flushing, dizziness, light headaches, and rapid heart rate. So you will have your, like saying cited in my homework. I would say that you have a rapid heart, and which is true, because which is normal, because if your food does not digest normally, you have so many symptoms that will be associated, like your heart will beat really fast, because the the meal did not follow the right road. The meal follow another road which is not supposed to be. So as a risk factor of dumping syndrome, we have a bariatric surgery, especially gastric bypass. We have a gastrectomy, in which a portion of all of your stomach is removed. We have esophagectomy. We have fundoplication, which is a procedure used to treat gastroesophageal reflux disease or ischial hernia. We have a pyloroplasty, which is done to widen the valve to the stomach pylorus, allowing food to pass through. And at the end, we have a bagotomy, a type of surgery to treat stomach ulcer. We are going to continue by medical management. Generally, the doctor will recommend to change the diet, because the first diet, remember, the food, what causes a dumping syndrome generally is a food higher in sugar. So see if when you realize that your food is higher in sugar, what the doctor will recommend first is to change your diet. Go with a low carb diet. Go with a mostly fruit and vegetable. There are even certain food that he will remove from your diet, such as banana. So the doctor will recommend you first to change your diet. So he will give you a diet mostly liquid or semi-liquid to follow, and he will remove hard, a strong diet, like something too hard to chew, like I don't know, not that much. I'm sorry. So if change in the diet don't improve symptoms, your healthcare provider may prescribe osteolyte, which is like, the other name is sandostatin. This anti-diarrhea drug, administered by injection under the skin, can slow the emptying of food into the intestine. Possible side effects include nausea, diarrhea, and fatty stool. So another medical management that the doctor can prescribe is a surgery. In case nothing happen, you can do a conservative approach that, depending on the situation, and it can do a reconstructive surgery or reverse gastric bypass for people who went through the gastric bypass. So at the end of our presentation, we have long-term effect of the disorder, which is avoiding food that can lead to weight loss and malnutrition, and avoid long-term disorder can be weight loss and malnutrition. So you want to, if you have a dumping syndrome not due to a surgery, you will have to review the food, the diet that you're eating, and because it will lead to a weight loss, and of course a malnutrition if you're not careful. So generally, people who have this kind of problem are people who went through a surgery. We went through bariatric surgery, which is like weight loss surgery. So those are the most of people who have that problem. Thank you.